Good morning, everyone. Welcome to the Health Coverage Insurance and Financial Services Committee. This morning, we will have a series of work sessions and a workshop on our portion of the budget. And I just want to announce the order of our work today so that everyone can be comfortable with that. We will be starting with our budget workshop, and then we will go on to LD 1636, then LD 1938, then LD 1331, LD 2004, and at that point, we may take a lunch break or we may take it a bit earlier depending on how quickly we go through the bills. And 1954 will then probably be after lunch and will provide an additional opportunity for parties to caucus if needed. Wow, I see two Representative Morrises. I don't know what that is.
I think I only get to vote once, though.
Yeah, I think
I was having a connection issue, and I just signed out and came back in, but that is weird.
It is super weird.
We can.
Okay. Well, we'll see if we can ask someone to try to get rid of the not so live Josh. And we'll keep the Representative Morris, who is live.
I don't want to get rid of the wrong one, so I don't know.
Well, I see one that doesn't move and one that
right. Let me see if I can. Okay, so that's the wrong one. All right.
That is the right one that just went to
stop video.
Yeah, stop it.
Okay.
All right,
so maybe I can get rid of that at least.
Hard to read. Well, once again, good morning, everyone. And before we move to our budget workshop, we're going to do committee introductions. So I will begin this morning with Representative Arford.
Thank you, Madam Chair. Good morning, everyone. I am Representative Poppy Arford, and I represent District 49, the western part of Brunswick.
And Representative Matheson.
Good morning, Madam Chair. My name is Christy Matheson. I represent District 1 in Kittery.
And Representative Connor.
Thank you, Madam Chair. Good morning, everyone. My name is John Connor, and I represent part of Lewiston.
Great. And Representative Melorano.
Good morning. My name is Gina Melorano. I represent House District 62, which is part of Auburn.
Ooh, and I missed Representative Evans, so I apologize for that. Let's go back to Representative Evans.
Thank you, Madam Chair. My name is Richard Evans. I represent House District 120, including the towns of Atkinson, Brownville, Dover, Foxcroft, Medford, Milo, Lakeview, and Honorville Township.
Okay, and Representative Blyer.
Thank you, Madam Chair. Good morning, everybody. My name is Mark Blyer. I represent District 22, which is all of Leamington and part of Buxton, Standish, and Limerick.
And Representative Brooks.
Good morning. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
And Representative Morris.
Good morning. I'm Representative Joshua Morris. I represent House District 75, which is Turner, Leeds, and Livermore.
Senator Brenner.
Thank you, Madam Chair. Good morning. I'm Stacy Brenner. I represent Senate District 30, which includes all of Gorham, most of Scarborough, and part of Buxton, and a nice section of the Mountain Division Trail.
And good morning. I'm Representative Denise Tepler. I represent House District number 54, which is all of the terrific town of Topsham. And I serve as House co-chair of the committee. This morning, we will be ably assisted by our analyst, Ms. Colleen McCarthy-Reed of the Office of Policy and Legal Analysis, and by our committee clerk, Ms. Edna Caford. who you will see on screen under HCIFS committee. And they are available to help anyone who has difficulty navigating Zoom. And we will only be calling folks in if there are specific questions from the committee regarding some of the issues that we're addressing today. So I will, with that, turn to Ms. McCarthy-Reed to begin a brief workshop on the budget.
Sure. I think as you all know, we had a public hearing last Wednesday with the Appropriations Committee on the items within the proposed supplemental budget that are within the jurisdiction of, or under the jurisdiction of the HCIFS Committee. The Appropriations Committee has asked that our committee make recommendations back to them in writing. And our deadline for that is Monday, March the 14th. So we wanted to sort of start that discussion today. Perhaps you'll be able to finish it and make some recommendations that could be then sent to the Appropriations Committee in a letter. If not, we have some additional time potentially on Thursday to finish up the discussion, but I'll pull up the worksheet that they provide to the committees, which will give us a good way, I think, to walk through the items and have an opportunity for the committee to take a straw vote on each of the items, if you're ready to do that today, that are proposed in the budget. So I'm going to pull that up.
Thank you, Ms. McCarthy-Reed.
Sure. I got a bunch of things to share today. So here's the worksheet that I sent off yesterday. So as you'll recall, this first page are a few items that relate to the health benefit programs that are within the Department of Administrative and Financial Services. And the first initiative proposes to establish an additional position in the Office of Employee Health and Benefits to provide expertise related to state and federal insurance laws, and would provide the funding for the related all other costs for that position. You'll see that it's it would establish that position in the 2022-23 plan year. It provides the personal services and the all other amounts for that to fund that position. I did want to say that the Accident, Sickness, and Health Insurance Internal Service Fund, it's not a general fund, but what happens is each state agency pays a certain percentage for the costs or the administration of employee benefits. And so the amount of money that sort of is pooled together and put into this fund, that will be the source of the funding for this additional position. So that's the first one. And then there are two additional.
Colleen,
Sure, yeah.
just wanted to stop and ask the committee if anybody has questions about that first initiative. And an initiative, for those of you who haven't worked on the budget that often, is something new, that the standard things are in the budget already. And because this is a supplemental, this is the addition of a position to the accident, sickness, and health insurance part of DAFs.
That's right. And it may make sense actually to stop on each one. And if there's, if the committee is prepared to make a recommendation, we can sort of walk through them each item. The Appropriations Committee does ask us to sort of take a straw vote with regard to each initiative, as opposed to a collective vote on all of the proposals.
Yeah, I think we could do that one by one. Is everybody comfortable with that? Okay. So let's see, I think I need a motion.
Does it make sense for me to, scoot off and then go back? Yeah, I can do that.
Thank you. That will make it a little easier to see people voting anyway.
Yeah.
So does anyone make a motion? Want to make a motion? Okay, I'll make the motion. I move that we accept this recommendation to increase the number of positions related to accident and health, and that we encourage the department to hire someone with some real expertise in health plans. Okay, so I need a second on my motion. Okay, Representative Matheson seconds. All those in favor, because this is a straw vote, we're just going to use hands in the box. Okay, hands in the box. Representative Quint, is your hand in the box?
I'm sorry, I just jumped on. I don't know what we're talking about.
I'm sorry. We're talking about the budget initiatives that we reviewed with the Appropriations Committee, and this is the first one, which adds an individual with some specialization in health plans to help manage the accident, sickness, and health portion of the state employee health plan. Okay, yes. So Representative Quint voted yes also, so it was unanimous of those present and voting. So I think we could say we would approve that or recommend that section of the budget. All right, so go ahead. Yes, let's go to the next one.
The next one is reflects a reorganization, transferring or reorganizing a part-time position to a full-time position, and transfers the position, the funding for that position from the general fund to the Accident, Sickness, and Health Insurance Internal Service Fund within the same program. So you'll see there's a reduction in the general fund costs for that half-time position. And you'll see the creation of a full-time position underneath, and then the costs again would be moved or supported by the funds in the Accident, Sickness, and Health Insurance Internal Service Fund. And so this would be, we haven't talked about this before, but it would be an allocation from that fund as opposed to an appropriation, because they have the funds to pay for the position. This is just the authorization from the legislature that they can use it. So it transfers the funding and then reorganizes the position from a part-time position to a full-time position.
Okay, so let's head back to not sharing. I see that Representative Connor has a question.
Thank you, Madam Chair. I was just going to move reference number 32 and number 33 into the budget.
Okay, that's a motion. Can I have a second on the motion? I see Representative Melorano seconded. Sorry, Representative Quinn, I saw Representative Melorano first. So I assume we're taking a vote on both the transfer and the allocation at once. We can approve both unless anybody has an objection. Okay. All those in favor of approving that part of the budget? Unanimous of those present and voting.
Great. The next one, actually, there are two of them. I'll sort of talk about them together. These are reclassifications of positions that have been approved by the Bureau of Human Resources. And again, this is the provides funding for the retroactive payment to the position. And again, it's provides transfers all other funding to personal services to fund the costs of the reclassification. So there are two of them that have been reclassified. Reference number 34 is a reclassification of a position within the firefighters and law enforcement officers health insurance program fund. And that's a program that's been set up to provide health insurance benefits to retired firefighters and law enforcement personnel. And then the second one, reference number 35, is an approved reclassification within the Office of Employee Health and Benefits, funded through the Accident, Sickness, and Health Insurance Internal Service Fund. And again, it provides funding from personal services for the retroactive payment for that, the date for when that, back to the date when that reclassification was approved. So it's a small amount of funding allocated in for both of those reclassifications.
Any questions from the committee about these allocations? I will say that these are essentially raises that have already been approved, and we are allocating the funds to take care of them. So if I could have a motion from the committee. Yes, Representative Arford.
I would like to move these items forward and fund them.
Well, they're allocations. So basically what that means is the money is already there, but we're allowing them to spend it.
Exactly.
Yes. Okay, so is that a second, Representative Evans? Okay, so I have a motion and a second. Everyone who would like to approve these sections of the budget, please put your hand in the box. Okay, I see it to be unanimous of those present and voting.
Great. That was the end of the items that related to the Department of Administrative and Financial Services. You'll just see the total here on this page, so you can see the total amount that's been allocated. And then the second piece of the budget items related to the Bureau of Consumer Credit Protection. The first initiative provides headcount for one principal consumer credit examiner position and adjusts funding between programs to correct an error. So last year, the legislature enacted, you might recall, that a bill that came through the committee related to student lending, and the fiscal note for that bill, Public Law 2021, Chapter 357, intended to establish the position on a permanent basis and provided the funding, but it did not include specific headcount for that position. The fiscal note also, there was the allocation in that fiscal note mistakenly identified the account that the money would be allocated from. And so this initiative corrects the error in the allocation and also provides the specific headcount for that position.
And just as a reminder to the committee, this was the student debt ombudsman that Mr. Lund had said, Superintendent Lund had said that he would take on personally, but I am assuming that that became a problem, and Mr. Lund has recommended that they in fact either hire someone or do a transfer so that there will be another individual responsible for that position. And that is certainly something I support. Any questions from the committee? I also wanted to briefly point out for the work that we did on the other section, the DAF section of the budget, it's actually a reduction in general fund expenditures and an increase in other special revenue use for those positions that we approved.
And just a reminder too, when we're talking about the Bureau of Consumer Credit Protection, we're also talking about other special revenue funds as well, not general fund. So you'll see that reflected in the worksheets.
All right, any questions about, yes, Representative Brooks?
I just wanted to voice my support for this measure. I think especially with the pandemic, a lot of people find themselves in a bind here, so I appreciate this item.
Would you like to turn that into a motion?
I move to move this initiative into the budget, or move this allocation into the budget.
It's an allocation and an initiative, so thank you, Representative Brooks, and a correction. Yes, I think that's a second from Representative Melorano, or do you have a question? No, it's a second. Okay. So I have a motion and a second. All those in favor, please put your hands in the box. Okay, again, unanimous of those present and voting. Back to you, Ms. McCarthy Reed, when you're ready.
Great. Okay, and then the last item on the worksheets is a reorganization and of a position within the Board of Dental Practice. It reorganizes a consumer assistance and hearing coordinator position to a health services consultant position and provides the funding for the reorganization of that position. So it makes a allocation of additional personal services funds and some all other funding, which is related to sort of the state cap charges are sort of the administrative costs that go back to DAFs essentially to support the
benefits.
Exactly. Thank you, Representative Tepler. So that's the second piece for the Board of Dental Practice.
All right. Any questions for Ms. McCarthy Reed about this reorganization in the Dental Practice Board? Seeing none, I'd appreciate a motion. Yes, Representative Melorano.
Thank you. I'll make the motion that this gets recommended by our committee to the AFA committee.
Thank you. Second, yes, Representative Evans, seconds. All those in favor? Again, unanimous of those present and voting.
Great, thank you. That was the end of the sort of the worksheet. So that's the all that was proposed in the governor's supplemental budget. The last thing I wanted to mention is you did have some testimony at the public hearing from Ms. Endy of Consumers for Affordable Health Care related to a bill that was passed out of this committee last session, LD 1390, that's currently on the appropriations tabled on the special appropriations table. And she asked that that be included in the supplemental budget or suggested that. I didn't know if the committee, I just wanted to remind you of that. And if that was something the committee wanted to include a recommendation with regard to that bill in your letter back to the appropriations committee or not.
Comments from the committee regarding Ms. Endy's testimony. I will remind the committee that this bill was our top priority in the last session, and yet it did not get funded. Yes, Representative Matheson.
This is the easy enrollment bill,
Yes,
correct? Yes.
yes, it is.
Yeah, I would like to just, I definitely would like to include this in our report back to the AFA, but I'd like to have a discussion around the fiscal note associated to that bill and a reevaluation on the fiscal note as well. Some sort of notation around that because I think that there was some issues around the fiscal note on that bill.
Yeah, I think, and certainly sort of with the passage of time, the bill proposed that it be implemented, you know, for the tax year 2020, this tax, you know, this year. So if you do move it forward, I think there'll need to be an adjustment in when the program is implemented, which will also necessitate sort of a another look at the fiscal impact. Additionally, with the passage of time with regard to LD 1390, the funding that would be required, if there is any sort of general fund or state funding that would be required, it would be the funding that would have to be appropriated would, if there is any funding that needs to be appropriated between now and January 1, because we're in this current biennium. So that also will require a reevaluation of the fiscal note and the fiscal impact. So I could certainly put that in to any sort of the language or the memo that you would send to the Appropriations Committee, and you can take a look at that and review it on Thursday before we send it back to, send it off officially to the Appropriations Committee.
Any other comments, questions regarding what Representative Matheson has suggested? Yes, Representative Arford.
Yeah, I just want to support what Representative Matheson has said, and to draw the committee's attention and to the discrepancy between not just in the amended bill, the figures, but also between those figures and the figures that are actually in the amended fiscal note. They do not match up. They do not make sense. So if we could also have an explanation of that, as well as the language that's actually in the bill, that would be wonderful.
Okay, yes. And I believe that this was a sort of bizarre fiscal note that projected possible increases in enrollment in main care, which is not something that our fiscal office generally uses to create fiscal notes, because it's not a cost directly associated with the bill. It's sort of literally a dynamic fiscal note, which they keep telling us they don't do. And the other issue with that is that at the time that we first passed this bill, I believe there were only somewhere between 60 and 70,000 people enrolled in main care. And at this point, there are over 82,000 people enrolled in main care already. So the department might want to help them recalibrate that, given that 12,000 additional people have already enrolled in main care.
You mean the marketplace, not main care, right?
I'm sorry, yes,
Yeah,
I mean
yeah.
the marketplace.
Okay, just making sure I understood what you meant.
No,
So
I
yeah,
am sorry, I'm getting the marketplace and main
Yes.
care confused.
yeah, no, I think that's all makes sense, and that's partly why I think if the bill does move forward, it would need there would need to be another look at the fiscal impact, or and a new fiscal note would need to be prepared for sure.
So are there any objections from the committee regarding including something about moving the bill forward as part and into the supplemental budget as part of our recommendations? Representative Arford, is that a new hand?
Well, I just want to recognize the fact that this is Representative Evans' bill. And if he would like to make the motion, I'd like to defer to him. But if he would not, if he's not interested, would prefer to have me make the motion, I will. But I would like to defer to him making the choice, as it is his bill.
I don't think we need a motion at this point, Representative Arford, because we're just talking about language that Ms. McCarthy-Reed is going to develop for us and we'll take a look at on Thursday. Does anyone feel we need a motion particularly on this? No. Okay, so we will revisit this after Ms. McCarthy-Reed develops some language for the report back on easy enrollment and our concerns and hopes that it might be included in the supplemental.
Great, thank you.
Okay.
I mean, that was all I had on my notes about the supplemental budget. I don't know if there's any other discussion you might have. I know the there were some questions about the home program that the Bureau of Consumer Credit Protection is working on implementing, and the department was going to follow up with some additional information about sort of the implementation plan for that, but I don't know that there's any further action that you need related to that for your report back to the Appropriations Committee. But if there's anything else that you wanted follow up on or additional information on, I'd be happy to sort of follow up for you on that if there are any additional questions about anything else.
Does anyone have additional questions about the home program, which I believe is part of the ARPA funds?
Yes.
Yes, so Representative Matheson, nope, that's what your question was about? Yeah, it's part of one of the uses that has been proposed for the ARPA funding.
Yep. So I will follow up with the department. They were going to get you some additional information on that. So I will follow up and ask them to forward that as soon as it's available.
Thank you, Ms. McCarthy-Reed.
Yep.
Okay, is everyone ready to turn to our bills? Okay, with that, we will move to LD 1636 and open a work session on LD 1636. And we'll let Ms. McCarthy-Reed share with us. She's very busy.
I've got a lot today.
We'll let her
I've
share
got
with
too many
us.
things on my desk today, so here we go. Did you want, I shared with you yesterday sort of the bill analysis on the original bill, but I know that you mentioned Senator Claxton has proposed an amendment, which I also shared with the committee. I'm happy to do whatever the committee wishes. If you'd like me to go through the analysis of the original bill, or if you'd like to focus on the amendment to start with, we could do that. Whatever, what would work best for you?
I believe we'd like to focus on the amendment. Is everyone comfortable with that? Do I see any objections? I see no objections, so let's
Okay, great.
focus on the amendment. I assume that the interested parties list has received the amendment.
Yes, I sent that out to the interested parties yesterday, as well as the analysis that I sent to the committee. So I believe they have seen it.
Okay, will you share, I guess, the proposed amendment with us
I will.
and take us through what it means and what's proposed here?
Sure. So this is a proposed amendment. It hasn't really been cleaned up. This is the language that Senator Claxton forwarded yesterday, so I didn't have a chance to really sort of clean it up. So if it does move forward, it will look a lot different, but I think it's useful for you to see where the changes are being proposed to the original bill. But essentially what the amendment would do is replace the language in the original bill related to the process for identifying international reference rates by the superintendent of insurance with a process for reporting by the Maine Health Data Organization. And so it takes out some of the language referring to the sort of the process and the program that would be set up into the bill, but maintains these provisions related to the identification of a reference drug. So all of this language would be stricken from the bill, and you would be left with a directive to the Maine Health Data Organization that you see here, that they would identify the 100 most costly prescriptions and the 100 most utilized drugs in Maine using their all payer claims data. They'd identify the manufacturers of those drugs and the average wholesale acquisition costs for each drug for the most current 12-month period. The second piece of it is it would ask the MHDO in conjunction with the Maine Prescription Drug Affordability Board to determine the reference rate for each drug identified, those 100 drugs I just mentioned, by comparing the wholesale acquisition cost of the drug to the cost essentially to the cost in Canada in official publications of the governments of the Canadian provinces are identified in the bill as Ontario, Quebec, British Columbia, and Alberta. And then it describes how they calculate what the reference rate would be. The lowest cost among the resources described and the wholesale acquisition cost for the most recent 12-month period. If a specific reference drug is not included in the resources described, the organization, the MHDO, shall use for purposes of determining the reference rate the price reported in other official Canadian publications, so they could look at other data from other provinces. Then the MHDO would be asked to determine the potential savings that could be achieved in Maine by using that referenced rate. Again, looking at their all payer claims database for the most current 12-month period. And then after that, those tasks are completed, the MHDO would be required to post this information on its website. The first report would be due in January of 2023. Provide that report to the legislature, to the new Office of Affordable Healthcare and the Maine Prescription Drug Affordability Board. It would give authority to the legislature to report out legislation based on the first report. But again, the proposal is that it would be an ongoing annual reporting from MHDO to identify using the sort of the 100 most costly drugs and the 100 most utilized drugs, then looking at what the reference rate in Canada would be and determining the potential savings if that referenced rate was paid instead of the current costs. So it would the amendment would then strike out all the rest of the proposal. So that's the proposed amendment as I understand it. I'm happy to answer any questions that you have. I do think Ms. Harrington from MHDO is here if you have any specific questions for her about how this would work. And you have others, I think, here who may be able to comment. I'm not sure. I'm just looking quickly to see if Senator Claxton is here. I don't see him in the attendee space, but I do see Ms. Harrington.
Thank you, Ms. McCarthy-Reed. And I will first turn to Senator Brenner.
Thank you, Madam Chair. I would like to start us off by framing the discussion with a motion ought to pass as amended by the bill sponsor's amendment that Ms. McCarthy-Reed just walked us through. I think it really gets to something we tried to do last year when we were amending the drug bill that ultimately didn't, it wasn't the report that was approved by the full legislature. So I think it gives us the capacity to collect data for things that could potentially help us with policy developments in the future with the data network and also the Office of Affordable Healthcare. So that would be my motion. Thank you.
Okay, I have a motion on the table. I don't know if Representative Evans' hand is a second.
Yes.
Yes, okay. Representative Evans seconds. I saw that Representative Melorano raised her hand after Representative Evans as well, but I believe Representative Bleier has a comment or a question. Go ahead, Representative Bleier.
Thank you, Madam Chair. I do. My question would be for Ms. Harrington.
Yes, can we bring Ms. Harrington in?
Absolutely. She should be on her way.
Good morning, Ms.
Good morning.
And yes, feel free to turn on your camera or not as you'd like, but Representative Bleier has a question for you.
Thank you, Ms. Harrington, for being here. My question to you is that we've asked you to do a lot of studies recently. I'm wondering if this particular study or this information gathering can be handled within the amount of people you have within your staff in order to accomplish that? Can that be done?
Yes, good morning. So my apologies. I've got an unstable internet. Can you hear me?
We can.
Okay, excellent. So yes, Representative Blyer, we can handle this reporting request within our existing resources.
Thank you.
Thank you very much, Ms. Harrington. And do you have any concerns about this form of the bill?
I'm sorry, you cut out. Were you asking me that question?
No, I was asking, yes, I was asking you if you had any concerns about this amendment to the bill.
No.
Thank you. Okay, and I see Representative Melorano has a question.
Thank you, Madam Chair. It's not a question. Just wanted to state that I do support the amendment. It's not everything I would have wanted to get out of this bill. I think this is a really awful problem in the USA, and we need to make strides on it. I think that this initiative will help us perhaps set the stage for reference pricing in the future, and I do support it. Thanks.
Representative Matheson.
Thank you, Madam Chair. I too support this, but I'd like to just discuss the reporting out and time period that the legislature has the ability to make policy changes. That date seems to just be for 1 year, that like the year at the reporting out period. Since this is an annual report, it seems like policy doesn't end after the first year. So I'm just curious how we might be able to change that language.
You could amend it if you wanted to give the committee the authority to report out legislation, or the legislature after each annual report is submitted. That's fairly, that has been done in other legislation. So if you wanted it to be an ongoing ability to do that in response to annual reports after the first one, we could certainly amend the amendment to do that.
Okay. Representative Brooks.
Yeah, I would like to just add that I think this is a modest or a small step for helping with transparency and helping continue the process of tackling this really big problem for constituents just everywhere. So I appreciate the efforts.
Thank you, Representative Brooks. And Representative Blyer.
Thank you, Madam Chair. I'm wondering, because I know that in the past, some drugs have been subsidized by the Canadian government. I'm wondering why we're only doing a comparison to the country of Canada and not other countries, so we'd have a better picture of where we stand here in the state of Maine.
Well, I think that's a good question. The bill started out using Canadian reference prices as part of the data. I guess one of the questions for Ms. Harrington might be if data from other nations is readily available, or as readily available as the published data from the listed Canadian provinces. Ms. Harrington, if you're still with us, can you respond about data from other nations?
So I'm not familiar with how readily available the pricing is from other countries. I can tell you that the information from the provinces in Canada is not as, we're still trying to figure out what exactly is available and how that does compare. We've been doing some research over the last couple of days since we were asked to consider this. And so that's why we have we suggested the language to the extent possible. So, I think if you wanted to include other countries, I mean, we could certainly add that to our report to the extent that that information is available. And I'll just give you a quick example of where there are differences. In the US, we use the system uses a coding called an NDC. That's how we identify drugs. In Canada, they don't identify drugs with an NDC number. They use a DIN number. And that number isn't a crosswalk to the NDC. So remember, the NDC identifies like the dosaging of the drug, the type of drug, the manufacturer. So there's some work and, you know, trying to crosswalk what is in this country to other countries' systems, which, you know, we're willing to take on. I don't know that you have to put it in the statute. I mean, we certainly will look at what other information is available from other countries, or if you want to put it in, I think, you know, again, having that language to the extent possible is we'll do what we can based on what information is available.
I think one of the questions that Representative Bleier is trying to get at is the question of when and where Canadian drugs might be subsidized so that the cost, the number that we might get would not fully indicate the cost to the government of the drug, but in fact be subsidized by Canadian tax dollars. I don't know that that happens at the wholesale price, acquisition price level. I guess one of the questions is, does that occur at that level? And if it does, is there a way to indicate that some drug prices have been subsidized?
I mean, again, we will look into that as we peel back this onion. I mean, I think that's, you know, that's one of the challenges is it's a very different system than the system here. And what data is publicly available and what isn't, you know, we don't know exactly, but we will do what we can. And I just made a note to include that issue as part of our research into all of this.
And so can we ask that your first report back include information about subsidies?
To the extent that, yes, to the extent that it is available, we will include that.
Does that satisfy your concerns, Representative Bleier?
I think that's a good step forward. I guess my second concern now is that if the information is not readily available, are we, you know, if drugs are being subsidized and it's not readily available, then the figures that we will retrieve will not be accurate. And that's kind of a concern. I understand what Ms. Harrington is saying. We're going to do the best that we can. I get that. But, you know, can it be real? Can that information be reliable if we can't really figure out what's being subsidized and what is not? That's it's a concern.
I'll just, if okay, Representative Tepler, my response to that would be, this is the first report and we don't know what we don't know. So give us an opportunity to look into all of this and come back to you all with a report that documents what we found. And, you know, I hear you in terms of the issue around subsidization. And to the extent that, again, the information is available, we will note that. And if it's not, we'll also make that notation. So we will be as transparent as we can with what is in the report.
It's very difficult for me to believe that there's not some public information about what level of payment involves the subsidies. I think that must be public information that because it's got to be formulaic in some way. So yes, Representative Arford.
Yeah, and I just want to further comment that this is a very interesting conversation, and it appears that we don't actually have any sourcing for the information that any of us are bringing forward in terms of documents coming from Canada that talk about subsidizing of their pharmaceuticals or anything like that. It is my understanding, again, and I don't have a source document right now to share to you, but I have read reports coming from Canada that talk about how they have also struggled in any form of regulation of their pharmaceutical industry in the same way that we have, in terms of them, if they've tried to regulate in certain ways, had the industry come back and say, well, we are going to take you, we will challenge that in court, that type of thing.
Representative Arford, I'm not sure that's relevant to this.
Well, where I'm going with this is my statement that I want to make is, it's my understanding that what we're talking about here is not the consumer's out-of-pocket cost, but the actual charge amount for this pharmaceutical product. And how much the consumer actually ends up paying for it is another matter. And if that's the case, then whether or not it's subsidized by the government is not, I am not seeing how that's actually relevant.
Representative Arford, it's a question at which level the government subsidizes the price. So do they subsidize the wholesale acquisition cost, which is what is listed in the bill as the cost that we are comparing? So we're comparing wholesale acquisition costs in the US to wholesale acquisition costs in Canada, and are Canadian wholesale prices subsidized? And so far, we don't know the answer to that question.
We need additional information.
Yes, well, and that's that Ms. Harrington has suggested that that is part of the report back that the committee will get in the first report. Any further comments or questions about LD 13? No, I'm sorry, 1636. The amended version of LD 1636. We do have a motion and a second on the floor. Seeing no further, oh yes, Ms. McCarthy Reed wants us to add something.
Well, just before you vote, I know that Representative Matheson suggested adding to the amendment that language about allowing the legislature or the committee to report out legislation after each annual report beyond just the first year. Is that something that you would want to add to the amendment? And then the second thing is, if you'd wanted to add a sentence or so about the subsidization discussion you were just having, that to the extent possible, they would include information about that in their reports as well.
I'm certainly comfortable with that. The motion came from Senator Brenner, so I will ask her to respond to that.
Thank you, Madam Chair. I would like to incorporate the friendly suggested amendment. Thank you.
There were two of them, subsidization and yes, okay.
Yes, please.
Both of those things.
Thank you.
Okay, and I believe Representative Evans, was that your second for the amended motion?
Yes, for the both of the amendments, yes.
Okay, I think we are ready for a vote. Is the committee ready for a vote? Seeing no objections, I will ask Ms. Kafer to call the roll, with keeping in mind that a vote of yes will move the doubly amended version of the bill forward.
Thank you. Senator Sanborn. Senator Brenner.
Yes.
Senator Brenner, yes. Senator Stewart. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Bleier.
Yes.
Representative Bleier, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Maloreno.
Yes.
Representative Maloreno, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Quinn.
Yes.
Representative Quinn, yes. 11 members of the committee having voted in the affirmative and 0 in the negative.
Thank you, Ms. Kayford. And so we will be sending LD 1634, I'm sorry, 1636 to the floor of the Senate with an ought to pass this amended unanimous report. Thank you, committee. And with that, I will close that work session and move to LD 1938, an act to prohibit discriminatory practices related to the 340B drug pricing program, and ask Ms. McCarthy-Reed to please screen share her bill analysis with us. We have not worked this bill before.
You have not, no. This is LD 1938. As drafted, the bill prohibits certain discriminatory practices related to the 340B drug pricing program, which is a federal program which allows eligible entities to purchase discounted prescription drugs. Senator Claxton, the sponsor of the bill, proposed an amendment which was shared previously with the committee and the interested parties list. It's also posted in the electronic LD file. That would reallocate the provisions to the main insurance code. As the bill was originally drafted, it put the provisions in Title 22, but directed the superintendent of insurance to have some responsibilities and seemed to be focused on the activities of PBMs and health insurance carriers, which are regulated under the Title 24A. So the amendment moves the provisions to Title 24A. It does retain most of the substantive provisions that were included in the original bill that again prohibit certain practices related to the 340B pricing program. The amendment did remove some language from the original bill that related to decisions about prescription drug formularies and a requirement that a covered person must sign a written waiver before allowing the use of a mail order pharmacy. I'm happy to share the amendment, especially after if you want to look at the specific language after we go through the rest of the analysis, but it has been shared with all of you previously. A federal 340B law, under that law and under this program, manufacturers that participate in Medicaid agree to sell outpatient drugs at discounted prices to what's called covered entities, which are defined in the law. And they include community health centers, hospitals, hemophilia treatment centers, critical access hospitals, rural referral centers, federally qualified health centers, and other sort of entities. The bill or the program allows participants in the program to use those savings to provide healthcare services to the populations they serve. As you heard at the public hearing, the bill itself is modeled on a law that was enacted in Arkansas. There were some concerns raised in testimony that the Arkansas law is currently the subject of ongoing litigation that challenges its constitutionality. Pharma has sued in the federal district court in Arkansas, challenging the law and arguing that it's unconstitutional. So the committee might want to consider the impact of that ongoing legislation. There have been there's been no decision at the federal court, district court level on that case, as I understand it. There also is some litigation related to federal rules that have been adopted pursuant to the 340B program. And so that is another area of litigation that's ongoing that hasn't been fully adjudicated yet. So I wanted you to be aware of those two things. And you have some additional background information about that in the LD file and in testimony that was filed with the committee. The other thing to keep in mind is the bill. I think if you look at the language of the bill, looks at sort of two things. There are some provisions in the bill that address the use of mail order pharmacies. And then a second piece of the bill deals with contracting practices of PBMs and carriers related to whether or not a covered entity participates in the 340B program, and the provisions that are related to mail order pharmacies don't appear to be tied to participation in the 340B program. They're just really tied to whether or not the carrier or the PBM offers a mail order pharmacy or the use of a mail order pharmacy to persons that are covered under their plans. And then you did have a number of concerns raised in testimony about the current practices of PBMs and carriers with regard to 340B program participants. Concerns were raised that the contracting practices may impact the ability of pharmacies that are contracting with covered entities. They might lose the benefit of those 340B discounts, and it will affect their ability to provide healthcare services to the populations they serve. You also had a number of pieces of testimony raising concerns about the impact on carriers and employers if the bill moves forward, that the provisions would prohibit efforts of carriers and employers to negotiate lower contracted rates that reflect the same discounts that the 340B program provides, both directly and through the use of mail order pharmacies. So there were some concerns raised about that. And then lastly, I noted a number of sort of technical issues that were raised in the Bureau of Insurance's testimony related to the definition of terms, how notices might be provided. There is a requirement in the bill that notice must be given to consumers of their right to use a mail order pharmacy. There's no sort of articulation in the language about when or how often those notices must be provided. They raised a question about whether the carrier and a PBM might be required to provide a same notice to the same consumer. They also raised a question about what discriminatory means in the bill in terms of the contracting practices. There's also a question that they raised about the impact on the use of any pharmacy provider, and whether or not that might require a patient or require a carrier to provide coverage for pharmacies that might not be in an insurer or a PBM's provider network. And then the last concern is, while there is some reference specifically to excluding main care and self-insured government employee plans from the bill, it doesn't specifically mention ERISA. And if those plans are not, if the bill is meant to apply to ERISA plans, then it would raise some preemption issues. So if you do move forward, it might be useful to clarify that the bill would not apply to self-insured, private self-insured plans, in addition to main care and self-insured government plans, if that's the intent. There also are provisions in the bill, as I mentioned, it authorizes the superintendent of insurance to adopt rules. The Bureau noted in their testimony that they really have no expertise with regard to the 340B program at the federal level. And then there are also, the way the bill is drafted, it makes, in addition to prohibiting certain practices by carriers and PBMs, which are regulated by the Bureau of Insurance, there are some prohibitions on manufacturers and pharmacies, and the Bureau does not regulate those entities currently. So they have some concerns about their authority to enforce compliance if the legislation moves forward. I'll stop there. I think that outlines some of the issues that were raised. I'm happy to answer any questions. I'm happy to pull up the specific language of the legislation. The last thing I guess I would note is the committee might recall with regard to the issue of mail order pharmacies and sort of steering and those concerns, that you did have a bill last session that Representative Tepler sponsored, LD 1450, which was amended but enacted and added a provision to the laws that govern carriers and PBM practices, prohibiting misleading communications to consumers with regard to to these issues. So that is something that is in the current law presently, that has been in effect for a short time, but was enacted last session.
Thank you, Ms. McCarthy-Reed. I see Representative Brooks has a comment or question. Go ahead,
Yes,
Representative.
I was going to say thank you for the thorough analysis and also the bill sponsor for bringing this issue forward. Yeah, I'm very tempted to make the motion, and maybe you could talk me through it. But this a 340B program in our community is so instrumental. I've had constituents reach out to me for themselves, their loved ones that have difficulties affording medicine. Our transportation systems with the pandemic and other issues have been a challenge as far as mail order pharmacies. So kind of those things coming together have made it really difficult for people to get what they need when they need them. So the 340B programs with the federally qualified healthcare centers, with the hospital-based centers, really helps patients and their families access medicines really directly and more affordably, with more continuity of care in a lot of ways. So I'll move that ought to pass as amended, or have, I know that it's not our jurisdiction, so I'm open for more discussion as well. So part of it would be in our jurisdiction. So to forward a question, Colleen, can you tell us what the options are at this point as far as what we can do as this committee to support this program?
I'm not sure what you're asking, Representative Brooks. I cannot support the motion you just made. Ought to pass on this bill.
Oh, I actually kind of withdrew that motion in the same breath, or in a breath really close. Like I was like, I want to make the motion, but I'm not. I'll withdraw the motion if I did make one, and wanted to say that it's a topic that's really important for us to consider, and just looking at the whole big picture. How can we help promote this interlevel communications for patients to get the best access that they need? It's a really critical point of access for people. And I know people have said to me, thank you for making insulin more affordable, but what about blood thinners? So it's just an area that's really needs our attention along with federal attention. And so I will withdraw the motion, but I just think it's a really critical topic that we continue to push forward on, along with the great work that we're doing.
Thank you, Representative Brooks. The issue that you're discussing is the cost to patients of drugs, and the 340B program is more about the cost of drugs to pharmacies that participate in the program, particularly FQHC pharmacies and hospital pharmacies. It's not about costs that are savings that are passed on to patients, except through charity care as provided by those institutions. So
okay, well, yeah, it does. Yeah,
this is not the bill to discuss the final cost to patients on. And I see that Senator Brenner has her hand up. Go ahead, Senator Brenner.
Thank you, Madam Chair. And thank you, Representative Brooks, for your thoughtful comments. I found in listening to the testimony that it was pretty clear that this was a federal issue that as a state legislature, we were going to struggle to be able to fix, and particularly with this bill, the way that it was presented. So at this time, I would like to make a motion ought not to pass. And I look forward to our friends at the federal government doing the good work of fixing this program so that it works as best as it can for Maine people. Thank you.
Was that a second, Representative Quint?
Yes, it can be.
Thank you. Okay, so it's been moved and seconded, ought not to pass. Further discussion by the committee. I will say that it's the committee's understanding that Senator King is working on this issue. And that people who would like to express their concerns about problems within the 340B program can communicate with Senator King around this issue. I also want to say that I think the majority of the committee feels that a state wading into a problematic and complex federal policy may not be the best path forward to create good policy. So we, I think, overall feel that this needs to be fixed federally, and don't want to wade in and mess up further some of the complications this program has. So with that, I think unless, does anyone else have a comment? Seeing no comments, I'll ask Ms. Kafer to call the roll on the ought not to pass motion.
Thank you. Senator Sanborn, Senator Brenner,
Yes.
Senator Brenner, yes. Senator Stewart, Representative Tepler,
Yes.
Representative Tepler, yes. Representative Alford,
Yes.
Representative Alford, yes. Representative Bleier,
Yes.
Representative Bleier, yes. Representative Brooks,
Yes.
Representative Brooks, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Evans,
Yes.
Representative Evans, yes. Representative Matheson,
Yes.
Representative Matheson, yes. Representative Malorano,
Yes.
Representative Malorano, yes. Representative Morris,
Yes.
Representative Morris, yes. Representative Quinn,
Yes.
Representative Quinn, yes. 11 members of the committee having voted in the affirmative and 0 in the negative.
So that is a unanimous of those present and voting ought not to pass. And with that, we will close the work session on LD 1938 and move to LD 1331 next on our list, and ask Ms. McCarthy Reed to please share LD 1331 with us.
Sure. So LD 1331, the committee had a presentation. This is a carryover bill from the first regular session. The bill as drafted would reduce the maximum rating factors for geographic areas from the current 1.5 to 1.35 in plan year 2023 and 1.25 for plan year 2024 and thereafter. That's the bill as proposed. It was carried over, and as you recall at our last work session, we had a presentation from the Bureau of Insurance, who's been looking at some analysis of the current geographic rating factors and some possible scenarios for changes. You tabled it after your discussion last time, and so I think that's where you are. You're sort of back to the bill or to some other proposals with regard to LD 1331. I do know that Ms. Hooper is here from the Bureau of Insurance. If their committee members have follow-up questions on the slides that were presented at the last work session, or about how the geographic rating factor works now with regard to individual and small group plans in Maine. I don't know if you need any further introduction than that. I can I'm happy to go back and do more, but and talk more about it, but I think that's where you are. And I don't know if the committee, with the benefit of that additional thought and time, the committee has further discussion or further questions for Ms. Hooper.
Yes, I will look to the committee. I see that Representative Morris and Representative Stewart have questions, comments, or concern. I'm sorry, Senator Stewart, please. And also Senator Stewart, when we get to your comment or question, we'll ask you to introduce yourself as well. But Representative Morris, please go ahead.
Yes, thank you, Madam Chair. I actually would I'll defer to Senator Stewart after, but I would like to have the Bureau come in because I do have some questions on process and stuff for this. So
Great. Okay, so shall we bring them in now or let Senator Stewart speak first?
you can let Senator Stewart speak first. Yes.
Okay, I'm sorry, Senator. Please go ahead.
No, that's fine. I'm Trey Stewart, State Senator in District 2, which is 51 communities in Aroostook and Penobscot counties. I live in Presque Isle. Sorry, I wasn't able to be here for the other part of this morning. EUT started at 9, so I've been over there having a lot of fun conversations since then. So yeah, I would echo Representative Morris. I think if, and specifically if when they come up, if they could, if it's possible to put the slides that we were looking at last time back up, I think that would be helpful in getting a visual, at least for me. I'm a visual type of person, to be able to see exactly what it is that we're talking about, because I think they presented 4 different scenarios last time. So if they could do that when they come up, that would be great, Madam Chair.
Absolutely. However, I think Ms. McCarthy-Reed can do the screen sharing of the slides. And do you want any particular scenario or scenarios to be shown?
So it's some conversations we've had offline. I think, I don't want to speak on behalf of anybody on the committee, but I think we're looking at option, oh, shoot, I'm trying to remember which one was which now. It was the one where the ratings are, there's only one rating for the state, rather than, I don't know what the corresponding number is to that one. Sorry, Colleen.
That's option 3. So,
okay.
So do you want to have Ms. McCarthy-Reed pull up option 3?
I will.
Okay. And I'm sorry, go ahead.
I was just going to say, I did bring in both Ms. Hooper and the superintendent, so I think they're both here. And if other folks from the Bureau need to come in, we can bring them in as well. So I think you're talking about this scenario, 1 rating area, Senator Stewart.
Yes, I believe that was the one that Senator Sanborn here today. I didn't see her.
Senator Sanborn is in judiciary today. So, but we were all with her last night when she was communicating with you. So the committee has certainly heard the conversations. So what questions do you and Representative Morris have for Superintendent Chapa or Ms. Hooper?
If I may, Madam Chair.
Please.
I guess the biggest question I'd have here for today is, if we were to move forward with scenario 3 under this model, what sort of corresponding language would we need to utilize in a committee amendment in order to effectively get this outcome?
Good question. Superintendent, do you have an answer for that, or Ms. Hooper?
Well, good morning, Representative Tepper and members of the committee. As you know, I'm not an attorney, and Colleen's probably better suited, but the way I interpret scenario 3, it prohibits geographic rating altogether. So it's probably just eliminate the provision that allows geographic rating in the law. I'd look to Colleen to confirm that.
I believe Ms. McCarthy-Reed is nodding.
Yeah, I think that's right. And that would be the question, if it would be, prohibiting it or requiring or having a factor, but requiring that factor to be applied equally in all areas of the state, as opposed to sort of separating them out into the 4 areas. So I think you could do either prohibit it altogether or have some sort of rating factor. And what I'm not clear on is if scenario 3 was including moving to one area with the current 1.5, or if it was a scenario that would provide in sort of the costs, estimates that are here, if that's a scenario that would be no rating factor at all. That was what I think wasn't explained to me in sort of what the scenario meant, moving to one rating area.
So I can try to answer. This is Marty Hooper, the Life and Health Actuary at the Bureau of Insurance. My understanding would be that you would prohibit geographic rating.
Okay.
Say that again, if you don't mind, Mark. Ms. Hooper.
Right. From the description of what you intend to do for scenario 3, I think the cleanest way to get there would be to prohibit geographic rating for the individual and the small group market, if that's what you intend. There wouldn't be a need to have a geographic factor for the whole state.
Thank you, Ms. Hooper. And I see Senator Stewart, do you have a follow-up?
Yes, Madam Chair, thank you. While we've got Superintendent Chapa here, I just want to make sure that there isn't anything that requires, I know that, like, for instance, Maine is allowed, I think, up to 4 geographic areas. There's nothing that requires that there be at least one. Is that correct? Or does that question make sense?
Well, I think so. I think the way I interpret the ACA, and I know one of my attorneys will correct me if I'm wrong, is the use of geographic rating is permissive. It's not required. And therefore it's, but when it is, there's statistical areas, that's not the right terminology, but it's equivalent. The statistical areas defined by the federal government. Maine has, and you got those, the number of statistical areas plus 1 under the ACA for the maximum number of geographic ratings. But again, I believe it's permissive. And the other thing is important, there's 2 factors I'd like to point out, if I may. I mean, one, I think the data shows there is an issue there, but it's important to remember this is data from 1 year, and it was a COVID year. So the data could be skewed. And the other is geographic rating is a zero-sum game. If we go to one rating, some rates will go up and some will go down in the state. It doesn't bring new money in to the system. It just disperses it. Well, it allocates it differently. That's a better way to phrase it.
Okay. And I'm going to ask Representative Morris to go ahead now.
Helps if I unmute. Thank you, Madam Chair. So my question, as I understand it, under that scenario, Superintendent or Marty, it's not having a rating of 1.25 to 1, because that's what I thought the actuarial analysis was. I guess I'm just a little trying to get clarification on what the analysis is, because for all the other scenarios, it was lowering it to 1.25 to 1 down from 1.5. Would this be making it a 1-to-1 basically everywhere, that you just couldn't rate for geography? So I guess it would seem like there might be a, more of a savings up in Aroostook in that area than, because that seems like a similar savings to what they had, bringing it down to 1.25. I guess I'm just trying to get some clarification on how it would work going to 1, just doing away with the geographic areas and having 1 for the whole state.
That's a Marty question.
Sorry, and I guess I'm a little bit confused by the question itself. So if there's no geographic rating, then the cost of paying claims is spread across the whole state. So like Superintendent Chapa mentioned, the carriers are still collecting they still need to collect the same amount of premium in order to pay out the claims they've been getting. But they just will no longer be able to price different areas. So it does eliminate some flexibility if there are some differences in, say, provider contracting, the actual cost of paying claims in an area. So there would be some subsidizing of the lower cost areas for the higher cost areas. Does that help answer it?
I think so. I like I said, well, in other words, in the other 3 scenarios that are laid out in the report, in these graphs, we're moving from right now it's 1.5 to 1 as far as someone who's in a more expensive part of the state can't pay more than 1.5 times than someone that's paying the lowest premium is how it currently works, correct?
Right.
So under the other scenarios, we're just moving. There's a couple scenarios where we're just moving where a few counties go. One, we're expanding to another geographic area, and in one, we're moving 3 counties into a new area, and in one, we're leaving all the counties the same. We're just lowering the rating. So in this one, it says that there's a savings up there, but I guess the best way to ask it is, would someone who, say, lives in Aroostook County that buys a plan be paying the same amount for their plan as someone in Cumberland County or someone in Androscoggin County? So if everyone buys the same plan with the same benefits and features, they'd be paying the exact same amount regardless of where they live in the state.
Correct, under the 1 rating area.
Okay.
Excuse me, I think I have to interject here, but I think we're forgetting age rating, which is still in effect.
Absolutely.
Right. No, that's what I meant. I apologize, Representative Tepler. What I meant was someone who is in the same age band would be paying. So if all those factors are the same, other than where they live, they would be paying the same amount.
Yep, good clarification. Same plan, same age. Those are still allowed to be rated.
Okay, thank you.
Are you all set, Representative Morris?
I think so. I think the other just on that is that obviously this was the one that had the drawbacks of potentially having, what would be the impact as it relates to, it seems to mention that there are issues with the insurance, the potential for fewer choices in certain areas that was, if I remember, this was the one that had that. That's a potential drawback on that scenario. I was asking Marty, is she still here?
Yes, sorry, to confirm that there is that concern that if carriers were not able to rate for a particular area, that they could choose to withdraw the plans that they offer. They might not withdraw entirely, but they could also structure their plans to not be available in those costlier areas.
Okay. Thank you.
Okay. Representative Arford.
Yeah, I have a couple of matters I'd like more information on. And there's 2 documents we're looking at. We're looking at the bill, of course, and then we're also looking at these charts and the assessment that we have already been given. And if we look at scenario 0 and compare that to scenario 3, it looks like in terms of the pros and cons, there's not much differential there. The decreases in the pros and the increases in the cons are basically the same. And I'm so, as that then relates to the bill, what will we see? What kind of increases are we going to see if in fact, based on the charts, there's no difference? Could either Marty or Superintendent Trapa comment on that, please?
Yeah, I'll try to address that. Part of it is the limitations of the study. As we mentioned when we were presenting, it's just based on 2020 claims, which was an odd year with COVID impacts. There's also other aspects of geographic rating that aren't necessarily built into this and could affect future trending, like provider contracting. That's changes and it is different in different geographic areas. So right now, our initial indication from looking at the data for 2020 was that based on medical cost ratio, that area 4 was being overcharged if you're going to target an equivalent loss ratios. So our approach was to look to see what different scenarios, we could suggest to correct that and try to get estimated premium impact, because we knew, that the committee was interested in that as well. So also in this study, we're aggregating, so we're not showing individual carriers and their particular claims data. And part of the reason for that is we get a better picture aggregating because if you look at each individual carrier, the counties are so small that we're not able to get a good picture. So this is showing averages and estimating impact. I think we would see different for different carriers if we were to implement. So I know that doesn't completely answer. I struggle too with keeping it the same. We're trying to show that it's possible that we would be able to bring down area 4 if we found that these claim results were consistent over several years. So we would like to study it more. We're interested in finding a solution. And so it's a snapshot. It's not a comprehensive view of the geographic rating.
Thank you very much. And my other question was in the superintendent's testimony, you mentioned that you are attempting to do your own geographic rating study because you have not done one for 10 years and that you're in the process of applying for funds to do that. I wonder if you have determined whether or not you will be able to go forward with that.
Yes, we did receive federal funding and we do have the resources to go forward with continuing to study this.
Am I correct in assuming that study, once it's done, will give us a lot more information on this issue?
Yes.
And when would that study be completed by, approximately?
I'm trying to remember when I think the end of our funding, off the top of my head without pulling it up, I think it was September 2023. But we're well on our way. With our consultant, we've set up the modeling. We've used 1 year. I think we can pull the other year in fairly quickly. So I think we'd be able to provide something if the committee were interested for next session.
Thank you very much.
Okay, and Representative Brooks.
Yes, I do appreciate all the expertise here. Most of my questions have been answered and a lot of things have been clarified. I guess one thing, maybe a preview, or maybe this might be directed more appropriately towards one of the insurance people here, but with the fluctuations that we're seeing with coronavirus and post-coronavirus, and the multifactorial issues around that, nobody has answers definitively, and it is worth studying, I believe. I'm glad that it's well underway. And it's important as well to keep an eye on, but maybe historically looking back, which you are more able to answer as opposed to looking forward, and coordinating like what has happened in other insurance situations where predictions might not have been accurate. What are the potential downsides to voting today to do something as opposed to studying more, or letting the study you're undertaking proceed? I mean, I guess that's my major question.
Thanks. Yeah, I'll try to answer. So we do have the prior data. We just haven't pulled it into the model yet to see. So we do have that data available, and we're also anticipating that 2021 data will be complete fairly soon. So we'll also have kind of a more recent year to use.
Thank you, Ms. Hooper. I guess I feel that the skewing of prices that's caused by the coronavirus is not great. That's just my take on that. I think that these prices have existed, this price differential has existed for a while. Representative Arford, is your hand still up, or are you? No, okay, thank you. Representative Evans, please go ahead.
Thank you, Madam Chair. And thank you for being here, Ms. Hooper. And I'm kind of wrestling with what Representative Tepper just led into. My concern is, are we in a position as a committee to make an informed decision based on the lack of in-depth information? As you noted, the information is very limited, and the decision that we make is going to affect everybody one way or the other in the state. And I'm just concerned, do you feel that that would be appropriate?
Oops, sorry, trying to get off mute. So if I understand your question, it does take away flexibility, as we mentioned, for the carriers to rate based on differences by geographic area. So, as we mentioned with COVID impacts, there might be staffing or access provider types of costs that right now are or could be projected to change. I'm trying to find the right words for it, but basically, if you were to prohibit geographic rating, then that would limit any future need or ability to charge if there were cost differences that came up later. Does that answer it?
I kind of think so, but thank you for your input. Thank you, Madam Chair.
Thank you, Representative Evans. And I see Senator Stewart wants us to have a question or comment. Go ahead, Senator Stewart.
Thank you very much, Madam Chair. So since we're in a work session, I'm just going to, I guess, make a comment at this point that, this information has been available for over a decade, I guess, at this point, not just in terms of, the last year, which is obviously a challenging one because of COVID and whatnot. But the long and the short of it is that because of these ratings, these area ratings, it's been, a significant amount of time where effectively what the end result is that rural counties are subsidizing urban counties. And that's not something that's new because of the pandemic. That's not something that we need, a study to inform us of, because we already know that, because that's been the trend for a while. And so I hope that as we talk about, even though we have 1 year of maybe challenging data, there's still this glaring inequality that exists between urban and rural that has existed for a long time, before and after COVID, right? And so if we don't take action at some point, you know, we're just perpetuating this inequity that exists within the system.
Thank you, Senator Stewart. Ms. Hooper, can you quantify for me in per member per month terms what the additional cost to approximately, granted all the limitations, per member per month in that 6 to 7% range for areas 1 and 2 would be? Looks like you're doing the math right now.
Yeah, well, I'm actually thinking of all the different varieties. So, you know, as we mentioned before, you can have age rating. There's also subsidized coverage. So I think you could have premiums of anywhere from $100 a month to you know, $500, $1,000 a month. So you're right, a percent is really a different impact, you know, for each individual, depending on their age and what plan they have. So I think it's hard to put a per member per month on that, unless you want to talk about an average.
I think I would want to talk about an average, just like was presented in the initial chart of costs, along with the medical cost ratios.
Let's see. Trying to find where we are for average. I don't know if we were to call a 500. So if you had a 500 per month and you would get a 6% increase, you'd add $30. So you would be looking at a $530 monthly premium.
Okay, I think that's helpful. And I see Superintendent Chapa wants to add something, so I will invite him to do so.
Thank you, Representative Tepper, Madam Chair. Just a couple of comments. One, we take this very seriously, and you know, quite frankly, the results of the Wakely study caught me and I think Marty off guard. But having said that, a couple of comments. When we did the first study, there was a differential, and it's not clear to me that differential didn't exist at least some period of time over the intervening 10 years from the prior study. And additionally, I know Marty, I've worked with her on rate filings, brings up geographic rating in the context of rate filing. So we do look at it. So, but having said all that, you know, it is an issue we need to focus on, and we won't let it go another 10 years before the next study. I can assure you of that, but it's not clear to me that it's differential that we're seeing with the Wakely study has existed for the last 10 years.
I apologize. My answering machine is on and it's very loud. So right now I wanted to ask the superintendent a question. Can you hear me clearly over that?
I can.
Thank you. I apologize. I guess I'm unclear on what you mean by that differential.
The differential in the Wakely report. I mean, it's significant. But again, when we did our study, when we first looked at this issue, we showed area 4 was higher than the other areas in terms of medical costs, the cost ratio. And that may no longer be true based on 1 year of data, but I'm just saying for the last 10 years, we don't know for sure if the Wakely report, the results of the Wakely report, the subsidy of the rural counties of the urban counties existed. Having said that, I completely agree with Senator Stewart. That shouldn't exist. I mean, it should be, the idea of geographic rating is to make it level, account for medical cost differences. It's not for one area to subsidize another. So.
Thank you, Superintendent. Appreciate the explanation. And Representative Brooks, you have an additional comment or question?
Yeah, I had a question about either Superintendent Chopper or Attorney Hooper. My thoughts are directed towards what are your thoughts about incorporating the shift, and I'm sure the study will incorporate this as well, but the shifting populations and the potential that per person claims will go up based on maybe delaying care or based on post-COVID type sequelae.
Yeah, you make a good point, and that's another piece of it. So if we're just looking at claims and premium, certainly that's one picture, but we also have to work into that utilization. So if up north things cost more, but people were actually delaying their care or putting off the office visits, that means that the utilization was actually lower. And we did see some indication of that in area 4 utilization was much lower than the utilization that was happening in the more southern counties. So that's another reason, as I mentioned, we'd like to study this more. This was just a first indication that the loss ratios were off, but we'd like to work in the other components of utilization and also projected provider contracting. And as Superintendent Chapa mentioned, we do, through rate review, have the ability to request data from the carriers, and we do have the ability to find their rates either excessive or inadequate. So we do have quite a bit of oversight that happens every year when we approve the rates.
Thank you, Ms. Hooper. Are you all set, Representative Brooks? Does anyone want to wish to put a motion on the table at this point before we continue discussion? Senator Stewart.
Thank you, Madam Chair. I would move ought to pass as amended with the amendment to effectively prohibit the use of geographic ratings within the structure. And Colleen, is that sufficient enough to draft that committee amendment? Do you have what you need there?
Yes, I think so, but I would need to know what plan year you want to start it in, when it would be effective. If you wanted it to be, the next plan year, January, for 2023 plan year might be challenging. So you may, I don't know, you may want to think about 2024, but that would be a useful piece of information for the committee to determine when carriers would need to comply with the requirements that no geographic rating.
That's a good question. I guess would be inclined to try to make it easier for the carriers to make this adjustment so that we don't risk them just dropping an area altogether, but they have time to plan for it. That said, I'm also mindful that that's another year that folks are going to be paying more to live in those areas. So perhaps this would be an opportunity to, how about we start with 2024 and then if I can get a second to the motion, I then ask Madam Chair if we could maybe break for a corner caucus. Would that work?
Absolutely. And I think, given that carriers are currently working on their rates, which will be posted in June or July, I think that's probably a good call at this point, so that those rates that would take that into consideration would be worked on for next year. So I am looking to see if anyone would like to second Senator Stewart's motion.
Second.
Representative Connor seconds Senator Stewart's motion, and I think we will take, well, I don't know how much time it will take, but we will take a Connor caucus time now, aiming to be back by 12:15, I would say. So I'll ask everyone to go to their corners, to their caucuses, and we'll be back here hopefully around 12:15.
All right. I'll send Republicans, I'll send you guys a link.
And I hope that all the Democrats have their link, but if they don't, we can send an email. Thank you.
Edna, I just wanted to say thank you for keeping me up to date with all of these votes that I'm missing back and forth to the two committees.
Oh, that's okay. Probably you're gonna be in tomorrow. Okay, I'm not sure, but I'll double check. I'll be up on the floor before they
Perfect.
start, if you have any.
Perfect.
Okay.
Thank you.
So committee, can you please come back in if you're available? I don't know where my caucus is. Yep, here they start to come. So Rep. Melorano and Rep. Arford, could you please turn on your cameras if you're with us? And I still need Representative Brooks. Here she is. Okay. Representative Brooks, can you turn on your camera, please? At least for a short term. Thank you. Thank you. Okay. So I think my caucus is not ready to take a vote today. Some more information is needed. So I'm going to turn to Representative Melorano at this point. Representative Melorano.
Thank you, Madam Chair. Yes, I do think we need more time for this, and I would make a motion to table, please.
I second the motion.
Okay, it's been motioned and seconded that we table this bill. That's not something that we can discuss, but what I think we can do with Colleen's okay is after we vote to table, we can specify what further information it is that we need to move forward. So I will ask, since it's generally considered a procedural vote, everybody to put their hand in their block if they support the tabling motion. All right, that's unanimous of those present and voting, so we'll bring to table. And is there anyone who would like to specify some specific information that they need on this bill? Representative Arford and then Representative Brooks.
Superintendent Chapa mentioned the 2012 geographic rate study. It's available on their website. If they have a ready copy of that and they could send it to us, that would be wonderful. And then the other thing we've heard from the insurers about but potential adverse outcomes of going with a statewide, with one geographic area. And I would like a further discussion of that, because with maybe some statistics to back them up, or some sort of data supported information, so that we can.
Representative Arford, I don't think you mean discussion. I think you would like them to provide us with more information, preferably in writing, I think, before Thursday.
Thank you very much, Madam Chair. I appreciate the clarification.
Thank you.
And I'll email the report right now, because I had emailed it to.
That's great. And Representative Brooks, you wanted to ask for something in particular?
Yeah, I'd echo those questions, like getting some more information based on the in-depth discussion that we had on potential implications of changing or shifting at this moment.
And I heard some conversation about the potential effect of utilization differentials on rates. And I guess that's something, if there's someone who could share information with us about that, that would be helpful. Okay, so with that, we have tabled, oh, I'm sorry, Representative Connor, go ahead.
Thank you, Madam Chair. I just out of curiosity for the chair, do we have any idea of timeline when we're looking at hearing this again? Do you know? Or
I think that we will probably have to add it in on Thursday, because I know that we are attempting to finish our work as soon as possible, as we're supposed to do.
yeah, that's what I was getting at, Madam Chair. Thank you. I just wanted to double check.
Yes, people will only have a couple of days to sort of get information to us, and we only have a couple of days to review it, because our timelines are very short at this point. And the chairs intend to try to get this committee to finish its work in a timely fashion. All right, so that brings to a close the work session on LD 1331, and I will turn to LD 1954. I'm sorry, not 1954, LD 2004, which we also have not yet had a work session on, and ask Colleen to present her bill analysis to us. And after this bill, we'll take a somewhat belated lunch break, if that's okay with everyone.
Sure. I'm going to share it right now. LD 2004 is an act to ensure fairness of representation in insurance disputes. This was a bill that the committee just received, just was referred recently and scheduled for hearing. As it's drafted, the bill requires property and casualty insurers to allow insured persons to select an attorney in an insurance dispute, and also would require insurers to pay attorney's fees for the parties that an insurer insures in the event of a dispute in which the insurer insures more than one of the parties to that dispute. You had some written testimony, and you also heard some testimony at the public hearing on this bill. There were a number of questions raised about whether or not the bill as drafted gets at the specific intent that the sponsor articulated during the hearing that was generated from a request from a constituent. But there are current practices for representation of insureds as part of claims or lawsuits, and that was explained to the committee about the process that's used currently. So think about whether the current processes for how insureds are represented in disputes is appropriate. The Bureau of Insurance did also indicate that they hadn't received any complaints related to the issues raised in the bill. There was also a question about the language in the bill. It refers to a dispute, but doesn't really define what a dispute means. Could it apply both to all types of issues, all types of claims related to both claims for liability questions, or also claims in equity? The sponsor, as I indicated, explained that he brought this bill forward because of a dispute between parties that were represented by the same insurer. But as drafted, the bill implies that all disputes could be subject to the requirements, particularly with regard to the first piece, which is allowing insured people to select their own attorney. As the bill's drafted as well, it applies to both the personal lines context and commercial lines context. So I think if you do move forward with something, you should think about whether or not you wanted to apply to both personal claims related to personal insurance, property and casualty insurance, or claims related to commercial property and casualty insurance. And as you talked about at the public hearing, under existing insurance policies, the insurer has a duty to defend their insured in any claim or lawsuit. They are obligated up to the limits of liability, and all defense costs are paid by the insurer. The choice of an attorney in those situations when an insurer is defending a claim is typically made by the insurer, as they bear all the costs of defending that claim. So some of the questions raised related to what the potential impact might be of allowing an insurer to select an attorney who may not have expertise in these issues. It was also suggested that the bill might require an insurer to breach their implied duty of good faith that they owe to their own insureds to defend a particular claim. And the questions were also raised about the implication for paying costs of all attorney's fees for both parties when the plaintiff and defendant have the same insurer. And would that, or does that have a potential, if these changes are made, to impact premiums that people pay for their insurance? And then lastly, in instances where there are potential conflicts of interest for an attorney, attorneys are subject to what's called the rules of professional conduct that are enforced or through the Maine Board of Bar Overseers, which license attorneys in the state. And there are also cases that establish sort of judicial precedent, some of which were specifically mentioned at the public hearing as to how conflicts of interest are dealt with, and particularly in situations where insurance coverage is involved. We don't have any of the fiscal information on the bill for its impact on the state yet. And I guess I'll stop there, and I'm happy to answer any questions. I don't think I see Representative Martin, who is the sponsor of the bill, in the attendee space, but you do have folks here from the Bureau of Insurance and others if you have any specific questions about LD 2004.
Thank you, Ms. McCarthy-Reed. Any questions or concerns from the committee for Ms. McCarthy-Reed? Seeing none, I will entertain a motion, and then maybe we can have some further discussion. Representative Morris?
I will move ought not to pass.
Okay, can I have a second on that? Representative Evans seconds ought not to pass. So we have a motion and a second on ought not to pass. Is there any further discussion or comment? I have one comment to make before we move to a vote. My comment is, I do believe that there is still a problem with insurance companies that have a conflict of interest as opposed to attorneys. But I don't think that problem is solved in this bill. And so I will be supporting Representative Morris's motion, but I would like to point out to the carriers that are here that I believe that when they represent both the plaintiff and the defendant in a case that's moving towards settlement, they have a conflict of interest that is problematic. Yes, Representative Brooks.
Yes, I wanted to just, thank the sponsor and the constituent for bringing the issue forward. A lot of times people don't seek out answers to potential problems that they may have. So it brings an issue to my mind that was brought as far as potential legislation. I mean, one of the people that were testifying pointed out a case of clear conflict of interest, and that does happen sometimes, but the remedies for that, I believe, are good, given that people know about them and are able to utilize them.
Thank you, Representative Brooks. Okay, with that, I see no further hands, and we'll ask our clerk, Ms. Kafer, to please call the roll for a vote on LD 2004. The current motion is ought not to pass.
Thank you. Senator Sanborn. Senator Brennan.
Yes.
Senator Brennan, yes. Senator Stewart. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Alford.
Yes.
Representative Alford, yes. Representative Blyer, Representative Brooks,
Yes.
Representative Brooks, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Evans,
Yes.
Representative Evans, yes. Representative Matheson,
Yes.
Representative Matheson, yes. Representative Melareno,
Yes.
Representative Melareno, yes. Representative Morris,
Yes.
Representative Morris, yes. Representative Quinn. 9 members of the committee voted in the affirmative and 0 in the negative.
Thank you, Ms. Kafer. So we have a majority report at this point, possibly unanimous on LD 2004 ought not to pass. And with that, we will take a lunch break and some of us will caucus and come back and work our final bill of the day. Do we have any language review in addition?
I just have one language review, which is just a fiscal note. So we'll
Okay.
be very quick.
Okay, so we have LD 1954 when we come back, and I'm going to give us a 45-minute break. So let's come back at 1:30 to finish our business with LD 1954. So see you all later. Have a good lunch. Okay, I would appreciate it if members of the committee would come back online. Okay, Representative Morris, are you there? Yes, he is. Okay, no, maybe not. People are moving around. That is the Representative Morris who left us earlier. So perhaps he'll be back. I don't know. And I will open a work session on LD 1954, an act to ensure access to prescription contraceptives. I believe we have not had a work session on this before, so I will ask Ms. McCarthy-Reed to present her bill analysis.
Here we go. This is LD 1954, as Representative Tepler said. As the bill is drafted, it would require health insurance policies to cover all contraceptive drug devices and products approved by the Federal Food and Drug Administration without any deductible coinsurance, copayment, or other cost-sharing requirement. If the Federal Food and Drug Administration has approved one or more therapeutic equivalents of a contraceptive supply, an insurer or HMO is not required to cover all of those therapeutically equivalent versions, as long as at least one is covered without any cost-sharing requirement. Under current law, coverage must be provided without any cost-sharing for at least one contraceptive supply within each method of contraception that is identified by the Federal Food and Drug Administration and prescribed by a healthcare provider. The language of the bill also makes some clarifying changes in the individual and group nonprofit hospital and medical services plan laws to be consistent with the laws governing other policies and contracts that provide coverage for prescription drugs or outpatient services, to provide coverage for prescribed contraceptives intended to last for a 12-month period. As I mentioned, under current law, both the Federal Affordable Care Act, and it's been codified in state law as well, carriers are required to provide coverage for one contraceptive product within each method of contraception with no cost sharing. What LD 1954 would do would be to require coverage for all contraceptive products within a method category unless the FDA has approved one or more therapeutic equivalents of a contraceptive supply. You did have testimony from proponents of the bill asking you to consider the impact of the bill on the ability for enrollees to choose the appropriate contraceptive without having to consider out-of-pocket cost or to have to go through the carrier's process for appeals. It was noted that under the federal ACA guidance documents, there was a recent FAQ related to compliance with the existing requirements. And it described some complaints being received from women unable to obtain a waiver of the existing requirements and to receive coverage for a prescribed contraceptive supply without cost sharing that's recommended by their clinician. In other words, they were seeking for approval to have a particular contraceptive that wasn't the one that identified within that method by a carrier without cost sharing. They wanted to choose another one. There is a process under the current law for them to obtain a waiver. There have been some instances of complaints, and that was noted, as I mentioned, in the federal guidance under the ACA. In response to that, the committee members asked for carriers and the Bureau of Insurance to bring back some more information about appeals or complaints that may have been received from Maine enrollees who are in similar situations. If the bill moves forward as well, you might consider whether there's a conflict with the federal law requirements for health savings account compatible plans. We've talked about this issue with a number of bills earlier this session, but the Bureau of Insurance testimony notes that the Internal Revenue Service has issued some guidance prohibiting plans from qualifying as an HSA compatible high deductible health plan if they provide coverage that goes outside of the deductible for any contraceptives that aren't approved by CMS as preventive services under the ACA, and male contraceptives is one example of those. So you might think about that as you move forward. And then lastly, the question about whether the bill as drafted would be a mandate requiring or triggering a review by the Bureau of Insurance under the process that I think all of you are familiar with. The Bureau's written testimony did note, I think, their view that the bill could be a mandate because it would require coverage for contraceptives that are not already covered by Maine law. So the committee might want to consider whether or not a review and evaluation would be necessary. Think about the timing for that. And also, I guess there's a question about whether you, in your view, this would be viewed as an expansion of an existing mandate rather than a new mandate, and whether or not the bill would add an additional benefit to the state's essential benefits package that may subject the state to the requirement to defray costs for ACA qualified plans. That's the analysis as I've prepared it. I'm happy to share with you some the current law or any of the specific things that were raised in the testimony. And I do note that I believe you have folks in the attendee space who are also may be able to provide some additional information. I don't know, I haven't received any written responses from carriers or the Bureau on the question about complaints about an inability to obtain waivers under the existing law. And I don't know if folks have additional information to provide to you on that point. And I will stop there.
I don't see any hands going up immediately on that point, so I'm assuming that folks didn't follow up with that issue of complaints. Actually, Ms. Pelletreau does have her hand up now, and we can bring her over perhaps to discuss that issue of complaints.
She should be coming. Yeah, here she is.
Good afternoon, Representative Tepler, members of the committee. Thank you for the opportunity to address you. I wanted to respond to the suggestion that I hadn't followed up. I did follow up. That doesn't mean I have comprehensive information for you today, but I did want to make a couple of comments. None of our plans have reported to me that there is what they would consider a big problem in this area. They're not aware of, a particularly high number of either complaints or, requests for reconsideration in the area of contraceptives. I mean, in terms of a benefit design, and I'll give you an example here. The vast majority of contraceptives are offered without prior authorization at the plans. So when you think about, for example, a pill, there are hundreds of versions of pills. They're inexpensive. They're largely available. Now, when you get into the more costly forms of contraceptive, even going so far as surgical forms, then there are often prior authorizations on those. So for example, one of our plans has 250 forms of contraceptives that they offer on their formulary, and only 9 require prior authorization. So I just wanted to put that a little bit in context for you. Thank you.
So, Ms. Pelletreau, can you, I certainly didn't mean to imply that you hadn't done your homework. I'm sorry if it came across that way. But also want to point out that this bill doesn't apply to surgical procedures. But also, the interpretation of this concept of waiving the requirement if a prescriber feels that a particular medication is more beneficial to their patient. Can you describe what that waiving process consists of and how long it takes for many of the plans that are part of your group?
I mean, the only response I can give to that is that, you know, for any exceptions process, there is law in place that requires certain turnaround time. I believe it's 72 hours. So that's what I could say.
Okay. Thank you for that. Are there any other questions or discussion from the committee for Ms. Peltro? Seeing none, thanks for your input.
Thank
And we will move you back through the wormhole. So are there other points of discussion or questions from the committee that anyone has at this time? Seeing none, is there anyone who would like to make a motion? Oh, I'm sorry, Representative Brooks, what is your point of clarification? You're on mute, Representative Brooks.
I just wanted to make a motion for further discussion or something, and maybe Colleen can help walk me through this, but I would put ought to pass as amended with an amendment clarifying that that there would not be a mandate process given the laws as they exist today, and that that would not be indicated at this time.
Representative Brooks, did you also want to include anything about the HSA plans as?
Yes. Please, yeah, thank you for helping me with that amendment. I did want to include the part about the adjustment to the HSA eligibility for help.
Okay, so I saw someone else had their hand up. I can't remember who it was. Representative Morris, please go ahead.
Yes, thank you, Madam Chair. I wonder if someone from the Bureau could come in and just kind of walk us through their thoughts, because they did indicate in their testimony that this was a new mandate, and I'd like to just kind of hear more on that.
And while we're waiting for them to join us and answer Representative Morris's question, Ms. McCarthy-Reed, does this legislation require an effective date as well?
I think it would be, yeah, I was going to ask about whether or not it might be something useful for the committee to specify an effective date, if you think that's useful. Typically, you've been doing one, with your other bills similar to this for the 2023 plan year. And there was a question, I guess, in response to Representative Brooks discussing her motion, I understood her to ask for language which would sort of exempt out HSA, the impact on HSA plans. She would propose that it would not need a mandate review, and you would include, I assume, the language you've been including about deferral of costs under the ACA with your prior bills that you've talked about. Okay, thank you. And then the only other question, I guess, is for the Bureau. Who would like to come over, or should I bring everyone over? I think I see 4 of them. So in the attendee space.
Morris, is there anyone in particular you'd like to have brought over? Or I see the superintendent has his.
Yeah, if he's willing to answer the question, he'd be the best one.
He's coming over. If he needs anyone else, he can tell me.
Superintendent, welcome. Representative Morris has a question for you.
Yes, and I hope Marty Hooper will join me. Well, but
Coming right over too.
All right.
If there's anyone else, let me know.
nah, an actuary should.
She's here. Welcome, Ms. Hooper, or welcome back, Ms. Hooper.
Representative Morris, we had a discussion about whether or not it's a mandate. And Marty actually handles all the mandate report, and it's a very difficult determination because we don't really know what we're talking about, what sort of benefits that aren't covered now will be covered in the future. And that's kind of where we ended up is we don't think it's a mandate, but we can't say for absolute certain because that's there could be things we don't know about that aren't covered now that are covered. That would be a new benefit.
All right.
I'm sorry I can't be more clear than that, but we really went over it several times and kind of came around to that conclusion.
Right. So yeah, I mean, because it has the potential, certainly to add costs into the system.
Potentially, it's difficult to say because it's right now contraceptives are covered.
Right.
So we like male contraceptives. If that became FDA approved, and there isn't any now, that could be a new mandate. But we don't know if that is likely or not.
Right.
I don't know. We discussed the idea of a study, and Marty can weigh in on that, but we weren't sure what they would study. So this is a tough one for us to whether or not it's a mandate or not. And I'm not trying to be evasive, but
No, I appreciate the attempt.
And Representative Morris, I guess, given what Ms. Pelletreau said, it appears that most methods are currently covered.
Correct. My other question would be along those lines, I guess, similar to what we asked, what Ms. Pelletreau addressed. Are there a lot of complaints related to this, with what this bill is trying to address? Have you guys seen complaints in the sense of women not being able to get the birth control they desire?
my understanding, we have not had a lot of complaints about regarding this issue.
And I will point out that I believe the advocates have expressed concern that they've received a lot of complaints from women who have been unable to get the birth control method in particular that they felt was best for them.
So I guess I'm just trying to figure out if right now it's covered with no cost share. So this bill is adding some sort of benefit into it in the sense of it's unclear whether or not there would be new costs borne by the insurance companies if we were to pass this along. So there is potential for new benefits in this.
Other comments or questions from the committee? I also don't think I have a second yet. If someone would like to second the motion. I saw Representative Arford raise her hand as a second. Or do you have a question, Representative Arford? You're on mute, Representative Arford.
Yeah, it's my understanding that this bill is relatively straightforward in that there was a benefit that was put forward through the Accountable Care Act coverage that allowed for within this framework of all contraceptives being covered without any out-of-pocket costs, but within every category, there was only one particular product. But if a woman and her provider of care determined that was not the best medical product for her, they could write a prescription for a different product and it would have to be covered. However, what's happened is the insurers are not allowing for that in the way that they should be. And so we're fixing it with this bill. Is that correct?
I think what this bill, just to clarify, my understanding of what this bill does is yes, but what this bill does is it says under the existing law, the woman could have access to that prescription recommended by her provider. But she would be subject to the cost sharing for that because it wouldn't be the one particular product chosen that's offered by the carrier without cost sharing. And what LD 1954 does, as I understand it, would require coverage for all contraceptives without cost sharing, unless there was one particular product that there was a therapeutic equivalent. That's my understanding of what LD 1954 would do.
So I'm afraid I need to seek some clarification on that, Ms. McCarthy-Reed, because it's my understanding that under the ACA, there is an existing waiver, or I'm calling it a waiver, but a process of waiving. And that process actually leads to no cost sharing on the product.
That's correct. Okay. But what LD 1954 would do is to eliminate the requirement for someone to have to go through that process to get access to a contraceptive without cost sharing. It would provide no cost sharing for all supplies, within each method. So all pills, all, IUDs, all different, all of the products within that category, for instance.
Although if there's a designated therapeutic equivalent according to the bill, it won't. So if there are a large number of low estrogen pill products on the market, one of them might be new and under patent still, but the others aren't. If they are considered therapeutic equivalents, then the lack of cost sharing can be on the one that's less expensive.
That's my understanding, yes. Yep.
Okay. So Representative Arford, did you want to follow up? Okay, you're all set. Yep. Okay. And Senator Brenner.
Thank you, Madam Chair. I have more of maybe some clarifying information that just might help people think this through a little bit more. Having prescribed a lot of birth control in my professional career, one of the things that's kind of challenging about birth control as a medication class that's a little different than maybe a heart medication is that because it's, especially for hormonal birth control, because it's tagged to a woman's cycle, you get like once you start it for the month, as you're waiting for that waiver to come through, or that 72 hours that we're supposed to be able to get waivers approved within that time, a woman needs to stay on the medication to match her cycle. And so you're trying to make sure the prescription follows that pattern. So any delay or it just pushes her out another 28, 31 days, depending on what method she's using, to be able to try another thing versus the thing she knows works. And so because the balance of hormones for our bodies is so it's so thoughtfully and carefully designed by our bodies. When you play with it with hormonal birth control, you don't want to go back and forth between different methods. So you don't want to have your insurance coverage for one method and you switch insurance and you can't get the new method that you have been on covered again. So, I mean, I see this particular piece of legislation as offering more capacity for patients, women in Maine, to be able to get the method that they know works for them without having to wait for a waiver process or be denied. And if the insurance companies are saying that they're already doing this, then I guess the discrepancy between whether or not it's a mandate and whether it's going to cost more is, that I get the sense that from the Bureau, what we're hearing is if it's already being covered, then the additional expense isn't there, but we're basically insuring for the women of Maine that yes, it's going to happen for them. They can't be denied. So maybe what I'll do is offer a second to the motion because I'm not sure we have one of those yet. Okay.
Thank you, Senator Brenner, and Representative Brooks, and then Representative Bleier.
Yes, thank you for the clarifying comments. And I want to, I see that there are people that bring forward experiences, like lived experiences, to why this is such an important measure in this realm. And I thank Senator Brenner as well for her experience with this matter. I don't think it's fair for me to ask for other personal stories when I'm not able to share a little bit of my own. Back in the day, I had heavy menstrual bleeding. Was looking for birth control at the same time, so there was an IUD that I had, and it was placed at the time, and it didn't help with the menstrual bleeding, and over time, that got worse. That led to a point where we talked even about IV iron, for example. That being said, it turned out that I had a fibroid that was fixed, and here I am. That's good. But sometimes the right answer is really, it's a personal choice between a provider and a patient. And other people aren't as privileged as I am to have that medical care and that intervention. People in much more dire straits that don't have that provider-patient continuity could be in very dire straits, and we need to really step up to help honor those patient-provider personal decisions. And I just encourage the committee to think about it and to not go down a path that could be destructive. And I do see that Nicole Clegg is here, and I would welcome her for comments as well, but I know other people have questions and comments too.
Okay, are you all set, Representative Brooks, or do you have something you want Ms. Clegg to answer?
Yeah, I would ask Ms. Clegg to join, and because she has much more depth and breadth of knowledge about this area. So I would welcome her to offer any sort of insight into this issue. But I know we have the Bureau of Insurance here too, so I would think that maybe if people had the questions for the Bureau of Insurance, but I would give Ms. Clegg the opportunity to give a broader perspective, or maybe I see Representative Bleier has this question as well.
Okay, so let's, does anyone have a question still for the Bureau of Insurance? Representative Bleier, is your question directed to the Bureau of Insurance?
It may be.
Okay, so let's do that first, and then if Representative Brooks still wants to bring Ms. Clegg in, we can do that, and she can speak to Ms. Brooks, Representative Brooks' concerns. Go ahead, Representative Bleier, with your question.
Thank you, Madam Chair. So I'm a little, I guess, uncertain about the waiver. If a waiver is applied for and the waiver is denied, then is there a cost associated with that? So if the waiver is allowed, then there's no cost sharing. If the waiver is denied, then the cost sharing stays in place. Is that correct? Am I understanding that correctly?
I believe that's correct. I think that would be a question more for Ms. Pelletro than the Bureau.
Okay, yeah, I'm trying to figure that piece of it out, so.
Would you like to have Ms. Pelletro? Oh, Ms. Ossenfort would like to answer that question. So we can have her come in, and we'll thank you, Ms. Hooper and Superintendent, for coming, and I think we'll send you back to the attendee room for now. Thank you. Ms. Ossenfort, Representative Bleier has a question that we believe you can answer.
Yes, or at least I hope I can. Under both the federal FAQs that address this issue and the state statute, we don't have the discretion to say no to that request. The way the law and the federal guidance are written, we are required to defer to the provider's determination. So we cannot say no to the request. But we do need that request in order to know that we have to implement a cost share waiver for that individual. So we do need some sort of process. I think the distinction between the law or the proposal before you and what's required today is whether or not everything has to be covered. Today, we have to cover, we have discretion as to which drugs to use oral contraceptives, as an example. We have the discretion to include certain ones on our formulary and exclude others, such as a name brand versus a generic. Cover one of each method without cost sharing. If the provider says that doesn't work for my member, and that would include somebody coming to us new who had previously been with another carrier, we've already been through this, that doesn't work for my member, we then have to grant the waiver and allow them to have that drug. But the difference is this is going to require us to expand our formulary, so all drugs will have to be on it. Folks have access to those drugs today. I think one of the challenges that we all are dealing with is there was anecdotal information, but we don't know if those were self-funded plans. We don't know if those are plans that were issued in Maine or what the circumstances were around some of the complaints. But if they submit that request and the provider says that this drug is more medically appropriate, we have to cover it at no cost share.
Madam Chair, may I follow up?
Absolutely.
So this would increase costs.
I mean, that's why a mandate study would be helpful to understand what's being covered today and what's not being covered, that this bill would, but it potentially does because it adds drugs to our formulary. So then a very expensive drug would be included in our formulary where perhaps, and we still might be able to apply a cost share, but we now have to cover that very expensive drug. Whereas today, we don't necessarily have to cover it.
Rep Brooks, I'm going to take chair's privilege and ask Ms. Osdenford a question before I call on you. Ms. Osdenford, can you describe for me what's involved in this process that waives the cost sharing requirement for drugs that wouldn't otherwise be included?
So I apologize. I mean, typically for prior authorization, they go through the portal and they submit the request. I don't know if that is the same process for the contraceptive. Again, there's no discretion, but that may be the process that you submit through the prior auth. You know, this is an oral contraceptive, most medically appropriate, and then we would process it. But I'd have to confirm that because I neglected to follow up on that.
Right, and legally that's supposed to happen within 72 hours for this kind of waiving process as well as for prior authorization?
There are timeframes for responding to those types of requests. Off the top of my head, I don't remember what they are, but that sounds right. I think it's 2 business days or 72 hours, whichever is less, but I'd have to go back and check unless Colleen can remembers.
I just want to be certain that the waiving of the contraceptive cost share is required as well as the prior auth, that's covered under that time frame. And I don't, Ms. McCarthy-Reed, do you have an answer to that?
Yeah, that's not a question I could answer particularly. I don't know that that's specified in state law. Our state law requirements for sort of prior authorization or utilization review are, as Ms. Osdenfort mentioned, non-emergency services requests must be answered by a carrier within 72 hours or 2 business days, whichever is less. And then it talks about and those would apply to prescription drug requests, like a request for a contraceptive, pill, but it doesn't specify, the language doesn't specify there if it's a request specifically for a waiver of cost sharing. And I don't think the existing law talks about a time period. It just says, as Ms. Austin-Fort said, described, if a provider recommends a particular contraceptive based on a determination of medical necessity, the insurer shall defer to the provider's determination and shall provide coverage without cost sharing. But there's no time frame in the existing law that says, you know, that decision or the insurer must do that within a certain amount of time.
I'd like to know more about what's happening with those waiver requests, Ms. Austin-Fort. It would be very helpful to have a sense of how long it's taking for insurers to respond to the requests for the cost sharing to be waived, and to know whether there are any, you know, barriers to fairly rapidly approving those requests.
Yeah, certainly I can go back and try to get that from our pharmacy folks.
Okay, and Representative Brooks, please go ahead.
Yes, and this is a more focused question again on the mandate, whether it's a mandate or not. And I do think that we're going in the correct direction with the motion as far as evolving science and evolving cyclical variations for people, with a provider and patient's discretion being the landing place for those kind of decisions. So I don't know if Ms. Alsford has any comments or questions about that, or comments about how sometimes it could be less expensive to really follow the guidelines developed in that kind of partnership.
Well, again, I think the existing law, both state and federal, requires us to defer to the provider's determination if there is a more medically appropriate form of contraceptive than what is available with no cost share. I think we're required to allow the member to access that at no cost share. And in fact, that language is actually struck in the bill.
Okay. So are you all set, Representative Brooks? Are there any further comments or questions from the committee? Apparently, because we don't have a senator, we cannot vote. So I think, unfortunately, unless I can contact Representative Brenner and get her to come back quickly, we will have to table this bill. So let me try to contact Senator Brenner. Everybody, hopefully sit tight for a minute or two. And if I can't get her to come back, then we will have to have a motion to table. I was just reminded that we can seek permission from the Senate president to vote without a senator.
Representative Tepler?
Yes, ma'am.
Yes, I did speak with Rose. I emailed her and she called me and she said there would be no vote taken unless there's a senator there.
Okay. Senator Brenner just said she might be able to come over. She's in AFA, but hopefully if we do this quickly, she'll be all right. So we'll see if she shows up in a second or two. Representative Morris?
Yes, thank you, Madam Chair. And just in the interest of quickness, if Senator Brenner is able to be here.
Oh, Senator Sanborn just joined us.
Okay, well, that works. So I'll just, in the interest of brevity, because we've discussed this, given Ms. Austin-Fort's and that the Bureau is unclear on this, we cannot support this motion simply because we believe that a mandate study is necessary to determine whether or not, just so we can be aware of the costs or any potential costs. I think that that is good government to make sure we know what, if there are any potential costs, what those might be into the system. And so we're not certainly opposed to the concept in this. We just believe that there needs to be a study of potentially new mandated benefits. So for those reasons, I will be opposing this motion.
Okay. Oh, Senator Brenner, if you need to go back to, we've got Senator Sanborn, so if you need to go back to AFA, I apologize. I didn't know she showed up just as I was contacting you.
All right, thank you.
Thank you. We just have to have a senator to vote. Okay. Representative Morris. Representative Brooks, did you still want to bring in Ms. Clegg? Yes, she did.
I'd say I would bring her in for kind of the big picture about it, or for any comments she may or may not have, or any further questions, but it's really the will of the committee, but I'd like to hear from her.
Well, it only takes one member to ask, so can we bring in Ms. Clegg? Welcome, Ms. Clegg. And I guess it's kind of important for the committee to hear at this point what your organization's experience is with complaints from women who have been unable to access the type of birth control that that their doctor feels is best for them.
So I think I can speak to a couple of points. One is we certainly hear from patients a struggle to get access to the type of birth control method that's medically indicated for them. I would also add, I think there were a couple things that came up earlier in the work session. One was around male contraception, and just so you're aware, the federal government's already moving on that and requiring coverage of condoms starting January of 2023. So the federal government is also addressing some of the issues that you're facing with here. And then finally, I think that there was some confusion around what is covered and what might be a potential new cost. So to be clear, all FDA methods that are approved for pregnancy prevention have to be covered through this waiver and no cost share process. So there really isn't a new cost to insurers if they're operating within sort of what's been outlined by the federal ACA. So I just wanted to sort of add that additional context if that might be helpful.
Yes, I think that from my perspective, it certainly is. Thank you. Are there any other questions from the committee for Ms. Clegg? Seeing none, we appreciate your, I'm sorry, Senator Sanborn has a question for you.
I paused too long. I'm sorry. I was hesitating whether I should jump in because I haven't been here for the rest of your work session. And it's always a little frustrating when someone jumps in and asks a question that's already been answered. But I thought it might be helpful to just elucidate like a little bit more pointed comment from Ms. Clegg with regard to this question about whether this is a mandate of a new benefit. I think what you just said, Ms. Clegg, is that if health insurers are following federal law right now and providing a waiver in appropriate circumstances in a appropriately, professionally, rapid way, then their costs would be identical to their costs under this bill. Is that accurate?
That is true. Yeah.
Thanks.
Okay, any other comments or questions for Ms. Clegg? Thank you for your testimony, Ms. Clegg, or your answers. We will send you back through the wormhole to the attendee space. And I'm looking to see if there is any further discussion from the committee. And seeing none, I'll ask Ms. Kayford to call the roll and we'll have a vote. Oh, I'm sorry. Yes, there is one more comment from the committee. Senator Sanborn.
Can you just review what the motion is?
Yes, the motion, which was made by Representative Brooks, is ought to pass as amended, with the amendments being some language around HSA exemption. And sorry, I've forgotten what the other piece of the amendment is. Colleen, can you help me out here?
Application of the 1/1/23 plan year, and the language related to not an expansion, that it would be an expansion of an existing law, existing mandate, and the no defrayal of cost language that you've included in prior bills.
Yes, thank you very much. So that is the motion on the table, ought to pass with those amendments. All right, so Ms. Kayford, please, sorry, another question from Senator.
Colleen, is it your view that we don't need to explicitly exempt it from mandate review under our own statutes?
I should have mentioned that. That was one of the things that was mentioned by Representative Brooks in her motion. So if that would be helpful, given the testimony from the Bureau of Insurance, we would include that too. I should have noted that. So usually when we've done that, we put in unallocated language that says, you know, notwithstanding the section 2752, this is being enacted without a review.
Yeah, I'm not sure I agree that it's a mandate, but it just seems like, well, I don't agree that it's a mandate. I don't think it is at all because of the reason that I just spoke with Ms. Clegg about, but I wondered if that was just important to do procedurally, given that the Bureau has suggested it could be considered one.
Yeah, and since it was, yeah, Representative Brooks mentioned including that, so I would include that. I forgot to include that when I was adding my summary of additionally to what Representative Tepler said. So yes.
Thank you. And interestingly, the Bureau actually, when they spoke with us this time, did not indicate that they were certain that it required a mandate. They were actually quite uncertain. So given their uncertainty, I think it's reasonable for us to make a decision to go without a mandate, although there are those among us who don't feel that way. Okay, so I'm sorry, Ms. Kayford, I believe we're ready for the vote now, are we? Yes, okay.
Okay, thank you. Senator Brenner, I'm sorry, Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner. Senator Stewart. Representative Tepler. Representative Tepler, your mic is off.
Oh, I unmuted myself. Oh, boy. Okay, yes.
Representative Tepler, yes. Representative Alford?
Yes.
Representative Alford, yes. Representative Bleier?
No.
Representative Bleier? No. Representative Brooks?
Yes.
Representative Brooks? Yes. Representative Connor?
No.
Representative Connor? No. Representative Evans?
Yes.
Representative Evans? Yes. Representative Matheson?
Yes.
Representative Matheson, yes. Representative Malorano?
Yes.
Representative Malorano, yes. Representative Morris?
No.
Representative Morris, no. Representative Quinn? Seven members of the committee having voted in the affirmative, one in the negative, and Representative Morris, What is your recommendation?
For minority report, ought to pass as amended requiring a mandate review.
Ms. Capert, I believe your count is incorrect. Could you give it to me again?
7 in the affirmative and 3 in the, I'm sorry, there's not 3 in the negative. Not, yeah, 3 in the negative.
Yes, that is right. Last time you said 1, so I was
7, I'm sorry.
so 7 and 3.
7 and 3, yes.
Yes, okay.
And ought to pass as amended?
Well, yet requiring, we want to require a mandate review, and Colleen would know better if that is the technical, what our report is, because we're not saying yes, we're not saying no, we're saying we need to have a mandate study. So I guess that still ought to pass technically.
Yeah, it'd be ought to pass as amended, and I'll replace the bill with direction to the Bureau of Insurance to do a mandate review of the proposal and report back. Yeah. Thank you.
Thank you. Yep.
Okay, so that brings to an end our work sessions today, but we still have 2 pieces of work, and I see that Representative Bleier has something. Is it on the last bill, Representative Bleier? No, something else. Okay, what is it, Representative?
Yeah, I
Bleier?
just wondered if I could register my vote on 2004.
I believe that you can.
I believe it was ought not to pass. Is that correct?
Yes.
That would be a yes for me.
You all set with that, Ms. Capert? Did you get that vote, Ms. Capert?
Yes, thank you.
Thank you. Okay, great. Okay, so now I believe there was one section of the budget that we missed actually at the beginning of our meeting. So Ms. McCarthy-Reed would like us to go back to it.
Sure, I would. And since you're just doing a straw vote, I don't think you, the same requirements for having a senator to do it, I don't think apply. But as you'll also be reviewing this again, the memo on Thursday, based on your input. But I did neglect to bring to your attention the statutory change that was proposed as part of the HCIFS items in the budget. And this would amend the current law to add the position of the Director of the Office of Affordable Healthcare, which was established in legislation that was considered by the committee last session. And that position would be appointed by the governor. And what this proposal does is establish the salary of that appointed position in statute to salary range 89. And it just adds that position to the statute. You'll see it underlined here at the bottom. And you can see the other positions within state government that it would be have the same salary as. So this makes a legislative change of the language to add the position to the list of positions for which the governor or the salaries are set by the governor and established in statute. And that's the proposed statutory change for this. Just for your information, if you were wondering what the actual salary range 89 is, the range, you probably can't, can you see this?
Yes.
When I'm screen sharing? Okay, good. I wasn't sure if this would work, but you'll see here is grade 89 is salary range 89. So there are 12 sort of steps, if you will, 1 to 12, and the lowest is an annual salary of 81,000, goes up to.
Oh, no, I'm sorry. We can't see that, whatever
okay.
that is. I think you have to probably pull down the other.
I do. I think I got to go up and share it again. So let me see if I can do that. Here we go. I wasn't sure if I could all go between screens. Can you see this now?
Yes, thank you.
Yeah. So grade 89, just for your information, the salary ranges from a little over 81,000 to 129,000 at step 12, if you will. So it would give the governor the ability to set the salary for that position within this grade 89.
Thank you, Colleen.
Stop there.
So I think what we need is a motion and eventually a second to accept that language for the budget. Yes, Representative Morris.
So moved.
Thank you. Can I have a second, please? I saw Representative Connor first, although there were several. Okay, so this is again a straw poll for our communication with AFA. So all those in favor of accepting that this language be put in the budget, put your hand in. Okay, it's unanimous of those present and voting. And everybody who's not present now will have a crack at this again on Thursday. Was it Thursday or next week?
Thursday. I'll bring it back Thursday because our report back is due on Monday. So.
Okay, so we'll have Thursday, we'll have that, the language for that to look over.
Yep.
Okay, and Ms. McCarthy-Reed, you said you had one more.
I do. I just have one more language review really quickly that has come back. This was a bill that the committee had looked at a while ago. It was LD 1887, which is the act to establish the Securities Restitution Assistance Fund. You'll recall that there was a public records exception or confidentiality protection for certain personal information for those people who apply for restitution assistance, protecting from disclosure their social security number, personal address, and telephone number. And the Judiciary Committee completed that review. But the bill also needed to undergo a final sort of fiscal review, which has come back, which will require the bill to be reported out as ought to pass as amended, just to incorporate the fiscal information. The committee's vote was unanimous ought to pass, but this would require it to be reported out ought to pass as amended to incorporate the fiscal information. And it just reflects or authorizes an allocation of other special revenue for the amount that will initially be transferred or be allotted or allocated for the Restitution Assistance Fund. So this reflects that allocation, and then the broader sort of narrative fiscal note describes what the bill does. It does provide a transfer of $350,000 from the available balance to the other special revenue funds to the Office of Securities, and then on an ongoing basis, it would allocate a portion of license fees, renewal license fees to the fund, and it provides for that allocation for those other special revenue funds to be credited to the restitution fund on an annual basis, and the department anticipates that that will be roughly $532,000 moving forward. So I just wanted to make you aware that that has been completed and the bill will be reported out.
And that was Superintendent Shaw's
yes
recommendation, and it removes any general fund expense.
Right.
Bill.
Right. The original bill that was considered during the 129th had some transferring of fines from the general fund for securities violations to the restitution assistance fund. So this version of the bill this time takes that out. So there's no impact to the general fund. It's all through other special revenue.
And it should not, is my understanding, go to the table.
That's correct.
So are there any concerns with that language review, or is everybody okay? Okay, so everybody approve that, Colleen, and
thank you.
Thank you. And we will wish you all a good night, and we'll see everybody tomorrow. Have a good, relaxing evening. And Colleen, is there anything scheduling wise we need to do?
I don't think so. I think we're gonna add LD 1331 to the schedule for Thursday.
Yep.
The one that we tabled, and other than that, I think we're set. Our schedule's already set for Thursday, so we're in good shape so far.
Great, thank you.
Thanks.
Thank you, everyone, and we'll see you tomorrow.
Representative Bleier, could you close down?